Let me introduce you to Dr. Fatih Abbas Nina, who is one of the few doctors prepared to talk to us. They're still under an enormous lot of pressure, not just because of their workload, but because there's I mean, 2 days ago we would not have been allowed in this hospital, am I right, Doctor? Because it was under the control of the government and the military, and in fact most of your casualties were soldiers then.
Yes.
Now civilians have come in and you're finding it very, very difficult to cope with lots of supplies running out. Tell me a little bit about how you are coping.
Yes, that's right. We have a lot of stress and we have shortage in the equipment and also in the staff. And lately we have a big problem, which is the oxygen supply. We now working in the storage, which is a couple of cylinders. It will be finished in any minutes. So also we have shortage of blood. We can't get volunteer to blood donation. Also we have the stress inside actually the hospitals. We hear the bombs. Also we afraid about also our safety. And I think you have seen this in minutes ago, how the stress was. And now in this moment I will ask all the Libyan people who can come in and help us. We need a volunteer, we need all the surgeons and the medical staff to come in and try to help. Okay, yes, we know that we have a lot of risks out in the roads, all the people terrified and afraid, but we need to sacrifice by something, okay, to have this moment go away. So please, for all the Libyan people who hear us right now, to come in, at least donate your blood, volunteer cleaning the hospital, clean the room, try to transport the patients and the victims. And also for all my colleagues who are close here to the hospital to come in and help. Also for those people volunteer in the transit management care points to come in to the hospital. We don't have any like military or someone to afraid from. We are here by ourselves. We managing and treating civilian Libyan people.
I can tell by your voice, you're very nervous, you're very stressed.
Yes.
You yourself are very emotional because you're having to deal with people who are dying all the time.
Kids, women, all ages, all kind of people, Libyans, Arab living here, all the nationalities, all the ages. Before like 3 or 5 minutes, we receive a baby, maybe 3 years old, and we have a lot of stress. A lot of stress.
You weren't able to save that little 3-year-old?
Yes, hopefully, yes. But so far he's doing good. But also, we like the oxygen supply. This is a big problem. Even we save a life, we can maintain it without oxygen supply. I mean, the ventilators, all the machines need oxygen. This is one of the principles of the care. So I don't know, like if it continue like this, probably we can do nothing. Maybe we just move to another hospital to help them, or we will declare that we will close this emergency department. Or like the situation we can continue actually, especially if we don't have a staff, we don't have blood, we don't have IV fluids, IV cannula, we don't have oxygen. How we can continue? Actually, we can't. Indeed, really, we are in stress, and it's really the most hard time we have seen here in Tripoli so far.
Were you able to feel part of the victorious mood that the rest of the town was enjoying just last night when the rebels moved into Green Square, or was it just you were too overwhelmed with all the things that you had to deal with?
Actually, even if we have a victory, but also there is another part, a lot of people they haven't seen the part we see here in this hospital or in the other hospital. We see a lot of people dying. we see people dying and bleeding, and we can't save them sometimes, actually, because we have a lot of patients coming at the same time, so and we have shortage in the hands and the team members, so we have do nothing. But always the big things need big sacrifices. So.
You've made a pretty big sacrifice yourself because you've all been just staying here for the past few days.
Yes, also, but a lot of people, they sacrifice by their lives. I mean, that's the big things. Maybe we just try to help those people. I mean, we trying to be a part of this victory, actually.
There are still a lot of Gaddafi posters around the hospital.
Well, I haven't seen, like today. I haven't seen any one of them.
Are you worried about the Gaddafi troops coming back into the hospital?
Well, I'm not actually worried about them to come back to the hospital, but I'm worried about the fighting in the streets and the victims coming to the hospital. That's the point. I mean, even they come back, maybe like us as medical staff, we will not be harmed, but we are afraid about what will gonna happen in the streets. That's what we afraid. Also from these sounds like the bombs and the loud sounds and really different bombs and weapon sounds that we didn't know what's going on actually outside. I mean, every time we hear a bomb or hear like a loud sound, we are afraid from, like the gush of the patient that come in, and we can't do nothing, especially in this situation. So hopefully the people hearing us right now, and some people, they can help even by sending us the oxygen cylinders that we can use even for temporary time or transient time.